Chama litasimama na misgela atashuka, lakini chama litasimama. Chama litasimama, chama litasimama. Misgela na misgela atashuka, lakini chama litasimama. Chama litasimama.
Are your people occupying?
Yes.
It's still on?
It's on. And we have an aim to really, we've been having meetings really all through. But you see, we can never call off something we get to objective. And all of us in one line, we had a better. And then interns have really waited for it. So our need is to have them posted with them. So we want even this meeting, we have had discussions, we're still going to have meetings in the ministry, and then we just get back.
To speak to the people's representatives and to explain what the ministry is doing. On the question raised by Honorable Timothy Wanyonyi, that the ministry explains why the ministry is yet to post medical interns who ought to have been posted in September 2023, noting that such a delay denies the affected graduates the opportunity to put into practice theoretical skills gained. Honorable Speaker and honorable members, the ministry had a total of 3,759 interns as at February 2024 for posting under the different cadres as indicated. We had 849 medical officer interns, 72 dentist interns, 289 pharmacist interns, 1,134 nursing degree interns, 145 degree clinical officer interns, and 1,270 clinical diploma interns. Of these that I have mentioned, 1,270 clinical officer diploma interns were posted, and they have already reported in their placement centers. Another 1,210 medical officers, dental officers, and pharmacists have been posted, and their letters of posting have equally been shared on their emails, and they are expected to have reported starting the 15th of April, and the ministry has started taking stock from the internship centers to determine how many have so far reported. The ministry is now in the process of finalizing the process for posting the nursing 2,404 nursing and clinical degree interns, and they will start collecting their letters, and we have equally posted on their emails. They also ought to report starting the 15th of April, which has already passed. Honorable Speaker and honorable members, I would like to note that, however, there was a delay in the posting of interns due to lack of budgetary allocations. In the financial year 2023-2024, the ministry was allocated a total of 3.6 billion to cater for internship program against a requirement of 5.7 billion. This resulted in a gap of 2 billion. This gap was considered during the supplementary estimate number 1 and was able to cater only for the 4,156 interns who were posted in July 2023. The ministry appealed to the National Treasury to provide funding of 4.8 billion to cater for the placement of the 3,759 interns through a letter dated 1st of February 2024. The National Treasury replied to the letter through a letter on the 13th of February, indicating that they were not in a position to provide requested funds and advised the ministry to rationalize the numbers and equally to review the internship policy with a view to accommodate more interns within the available budgetary provisions. Following the guidance from the National Treasury, the ministry wrote to the Salary and Remuneration Commission for guidance on how to rationalize that. The SRC responded by providing stipend rates to be payable to interns. With the rates from the SRC, the ministry wrote to the National Treasury and managed to secure 2.3 billion to post the 3,755 interns. It is on this rate that the interns I've indicated above have been posted. Honorable Speaker and honorable members, on the second part of the question, that the ministry provides timelines to which the collective bargaining agreement signed in 2017 between Kenya Medical Practitioner, Pharmacy and Dentist Union and the government will be fully implemented. Honorable Speaker and members, the collective bargaining agreement signed with KMPDU in 2017 continued to be implemented by the national government. The national government has so far undertaken the following to fulfill its obligations under the CBA. 1, it has facilitated the payment of basic salary arrears accrued by the national government entities arising from the 2017-2021 CBA. And I would like to confirm that indeed the national government has actually even paid in excess, and there are some doctors who owe the national government some money. The national government has also provided grants and scholarship for eligible postgraduate medical officers based on immediate service needs basis. Equally, the national government has provided comprehensive medical insurance to the doctors at the national government level. In the financial year 2023-2024, the ministry posted 4,156 medical interns in July 2023 at a total cost of 4.3 billion. These interns are due to complete their internship in June 2024. Similarly, the ministry secured 2.3 billion to post the 3,759 medical interns according to the SRC advisory rates. However, there are challenges in implementation of some of the provisions, including the areas of internship. These challenges will be addressed in the new cycle of negotiations of the CBA, which is ongoing. It is also important to note that a good number of those aspects of the CBA need to be implemented by the county governments. The third question, Honorable Speaker and members, outlined the steps being taken to resolve the recent dispute and end the strike to ensure uninterrupted healthcare delivery. Honorable Speaker and honorable members, the ministry is taking various steps and measures to resolve the ongoing strike. The measures being taken have been categorized into immediate and short-term, medium-term, and long-term. In the short-term and in the immediate, the ministry has posted all interns, and this posting was from 2nd of April based on the revised rate of SRC. All the interns ought to have reported to their internship center by the 15th of April. Honorable Speaker and honorable members, I've said the ministry is in the process of collecting returns from the respective internship centers. In a few days, we shall be able to report on how many of these interns have actually reported. But we confirm in the affirmative that the clinical officer diploma interns have reported, and we have returns at the ministry. The ministry has also requested for 267 million for payment of postgraduate registrars' fees arrears. I stand to confirm, Honorable Speaker and members, that in this week, the Ministry has received a confirmation from National Treasury of 200 million that will be given to the Ministry to be able to pay these arrears. The Ministry has also requested SRC to advise on the demand by the Kenya Union of Clinical Officers to have their risk allowance increase from 3,000 shillings to 15,000 shillings. Honorable Speaker and honorable members, this is a 500% increase. So the Ministry awaits for guidance from SRC, and based on the guidance that we receive, we shall be bringing this into the budget so that then once approved, we should be able to effect it. The Ministry has also requested the Public Service Commission to review the clinical officers' career progression guidelines. The medical laboratory officers who have joined the doctor strike do not have a recognition agreement with the government. Therefore, the Ministry has written to them citing the criteria that is required for them to be recognized as a union, and we wait for them to return back, having met the criteria, and then we start the process of recognition. Those are under the immediate and short-term measures. Honorable Speaker and honorable members, under the medium-term measures, the Ministry of Health is reviewing the internship policy to address aspects of the program, including the need for students to transit to internship without any delay. The internship policy will be finalized within this month of April. Happy to report, Honorable Speaker and members, that yesterday the Ministry undertook internal stakeholder validation, and it went very well. And next week we shall be proceeding to external stakeholder validation to receive the comments of the external stakeholders. Honorable Speaker and members, the Ministry is ongoing with the CBA negotiation. The 2017 CBA lapsed in 2021, and therefore we are in the process of negotiating on the new CBA to be signed. The Ministry is also actively participating in the whole-of-nation approach discussion that were ordered by the judge of the Employment and Labor Relations Court. In the long-term measures, Honorable Speaker and members, the Ministry is in the process of developing a comprehensive human resource for health policy to address all aspects of human resource in the country, in the entire spectrum of the value chain, from production, supply, internship and regulation of employment, retention of the health workers, distribution and stock density, skills and mix, including motivation and productivity of the human resource for health. The Ministry also in the long term would want to operationalize the Kenya Health Human Resource Advisory Council to enable it to execute its mandate. This entails providing the necessary budget finalization of the human resource instruments in order to obtain the necessary skills and capacities to execute their mandates. Other measures that are being taken by the Ministry is that the Cabinet Secretary, Ministry of Labor and Social Protection, was appointed by the court and has appointed 3 conciliators to guide the parties to arrive at the dispute, and the process is ongoing. To arrive at a resolution, and the process is ongoing. The court also appointed the whole-of-nation approach that is being led by the head of public service to bring together both levels of government and entities to the dispute with a view to seeking a solution to perennial issues in the health sector, and the process is ongoing. Honorable Speaker and honorable members, I hereby submit. Thank you.